It's really just enough to be able to determine if you're a good candidate for IUI or IVF. It's not really enough to determine why you're having the issues you're having.
Hello, my name is Joey Coppedge, the Fertility Nutrition Coach, and I'm teaming up with other champions of fertility healthcare to shed light on its importance and highlight its diversity. Today, I'm joined by Marc Sklar, the founder and creator of the Positive Pregnancy Method, who is a natural fertility expert specializing in functional medicine. Marc, thank you for being here. Welcome.
Thanks for having me, Joey. It's a pleasure to be here.
First of all, you're a natural fertility expert. Is natural fertility exactly what it sounds like?
Yeah, my goal is to help couples get pregnant naturally. Although with that being said, about 50% of the couples that I work with are doing either insemination or IVF. And we try to, shed the importance of a natural approach, at least in conjunction with that, if they are going through those assisted techniques, to enhance those success rates and make it work hopefully the first time and not the 10th time.
I think one of the biggest surprises that people usually, will confess to is that I really thought it would be a lot easier than this. And then they're on their second and third and their fourth cycle, only to then sort of ask, what else should I be doing here? Am I doing something wrong, or are you doing something wrong? Give me the elevator speech on what is functional medicine. That's the other kind of section of your title.
The best way I think I can explain it to those who are watching is, you've gone into your doctor and you say, look, I don't feel well. I've got, breast tenderness. I'm bloated. I'm fatigued. I'm not sleeping well. My cycles are irregular. And I'm gaining weight. What, is there something going on? And your OB says, well, let's run some blood work, right? And so they're, okay, let's run some blood work. So you come back 2 weeks later, your blood work is back in, and your OB says, hey, guess what? You're just fine. Your blood work came back perfect. You're healthy, nothing wrong. But this person still feels like crap, right? Like they still feel awful. So just because your blood work is within normal lab values or clinical lab values doesn't mean that you feel good and that you're healthy. And so from a functional perspective, we want you to function optimally, to feel good, to feel healthy. And part of that is that our reference ranges when we're looking at lab work are much more narrow. So we take those bigger reference ranges and make them often more narrow. And that's that optimal functional range that we want a patient to be in, or a person to be in, so that they can feel better both in blood work and in function and health.
You mentioned, somebody going to their doctor and I feel like crap, and then let's do this test, and then the test kind of comes back normal. Somewhere between 15 and 30% of infertility cases can be classified as unexplained, right? So, sperm is good, ovarian reserve is good, tubes are open, there's no signs of scar tissue that you can diagnose endometriosis with. And so then the recommendation usually would be IUI or IVF, but you think there's more work to do before resorting to treatments like those. Isn't it just quicker and easier than searching for underlying causes? Tell me more about that.
Yes, there is this misunderstanding that it might be quicker to just go to IUI or IVF, but it's not. Look, the reality is when you go in for IUI or IVF, they are often looking at you and creating a protocol and deciding on what medication they're going to use based on your hormone levels, based on your age, based on your height and your weight, right? But it's still an experiment. Now, all that being said, it's also they're doing that with what are the 3 protocols that they're comfortable using. Each office might only use 2 or 3 protocols that they're very comfortable using. So not only are they trying to determine that based on those parameters I mentioned earlier, but they're also trying to fit you into one of those protocols. What happens if you don't fit into those protocols, or the dosage is just off? So now you've just spent $3,000 or $5,000 and like, oh, that wasn't quite the right protocol for you. We're going to tweak it the next time. We're going to get it just right. But the reality is, we just don't know how you are going to respond versus somebody else. And we're all unique. We all have our own issues that need to be accounted for. And if they don't have all the information, which often they don't, then how can they create the right protocol for you? when they just run blood work for any couple, it's really just enough to be able to determine if you're a good candidate for IUI or IVF. It's not really enough to determine why you're having the issues you're having.
The experiment analogy, it's not even an analogy. The reality that it's an experiment is it's true. And that doesn't necessarily mean that somebody's just reinventing the wheel every time. But unfortunately, with these types of experiments, you're also running against the clock. And the patients who are, fitting the bill for it are well aware of that. And so that's why, that's why it's a much bigger deal than like, okay, well, we'll get there. We're whittling down these possibilities. We don't have time for that really.
Right.
IVF is a godsend of science when we have no other choice really. But if we jump into IVF without digging for more answers, don't they or won't they pop up in other parts of the pregnancy as well?
Potentially, but the reality is your reproductive function not functioning optimally is really a loud cry for something else going on in the body, because your reproductive function is not typically the first thing to go off when there are health concerns or health issues. It's usually one of the last. For instance, someone who has PCOS, polycystic ovarian syndrome, they will, I bring this up because you mentioned about, will it make things more difficult during the pregnancy? They're going to be more at risk for gestational diabetes. So knowing that, we want to get that under control before they get pregnant. So one, they can have hopefully an easier time getting pregnant. And then two, that they can have a healthier pregnancy moving forward. And they don't have to worry about all of those complications, because those complications are not just complications for themselves, but obviously complications for the baby as well.
It's very easy to think of, I'm either going to get pregnant or I'm not going to get pregnant, and that's it. It's black and white. But there's this whole like ballet and choreography of, with hundreds of different dancers contributing lots of different, parts to this performance, I guess. And if one of those dancers gets sick, or if one of those, the usher doesn't, put somebody in the right seat, it gets off kilter. It's a house of cards, kind of.
Yeah. So were you a dancer at one point?
No, I just think it's a good analogy.
Like, oh, okay. Yeah, I haven't thought of it.
My husband was a dancer, but I don't know. I just, sometimes you think of an analogy and you're like, oh, I'm going to go down that road. I think I could probably also make that analogy with like cars or machines, but I'm not that that knowledgeable. Most of our upbringings, or the education we got in PE class, and from our families and everything in our society, we've been conditioned to avoid pregnancy until the time is right. And in doing so, we often never condition the diet and lifestyle behaviors that promote a fertile body when the time is right. What are some of the most common factors that contribute to infertility?
Stress is one I kind of alluded to earlier. And this to me is the biggest piece. It's also, I think, one of the hardest pieces to really manage for anybody with any health condition. We know for sure, you can look up in PubMed, you look up stress and put next to it any health condition, including fertility, and you will find tons of research studies that show that increased stress makes X, Y, and Z worse, whatever it is. Fertility is no different. And so those couples going through fertility struggles often are compared to those individuals who have cancer, cardiovascular disease, really major health conditions. So we know that it's a huge impact on our overall health, our relationships, our life. But we also understand, or at least I do, that, I can't just tell someone, oh, just relax. Just get rid of your stress. Like, stress doesn't happen. If 2020,
they're probably already being told that anyways.
Yeah, right. They don't like it anyway. But if 2020 has showed us anything, it's that, stress is not going away. We have to find ways, and we have to create tools for ourselves to really manage that. There'll be times when we have more stress, times when we have less, but we need the resources to be able to manage that properly on a regular basis so that it can be relatively controlled. And those are really those big foundational pieces that I think we all need to spend a lot more time really solidifying.
Stress is so tricky too, because even before 2020, it just, I guess, our relationship with work, our relationship with, being on Instagram, our relationship with just being a part of society is do more, produce more, be bigger, be better. And in a way that's good. Yes, we should grow and learn and develop and be better. But sometimes that can put undue pressure. We could put undue pressure on ourselves for it. And we don't even realize that we're just living in a state of constant stress until it's too late, until our body, to use your analogy, until our body starts screaming at us that, hey, you're stressed out. All these metabolic functions, I'm going to shut down now. So you'll start listening.
Yeah.
How much time does somebody need in order to sort of change things around? Let's say somebody's been, trying to get pregnant for a year and now they're, technically infertile. How much time would you recommend between the time they start changing things and the time they can start trying again?
I think there's very rare circumstances where I think someone should stop trying, for a period of time. There are times where if we've got severe endometriosis, fibroids, cysts, blockages, and just the nature of the treatment for things like that are relatively intense. And so when we're trying to treat that, we're not also creating a conducive environment at that moment in time for conception to happen. So those are times where I definitely say, hey, let's take a little break from trying. Outside of that, I think we all need at least 3 months of preparation, of foundational work to set a healthy environment to give ourselves a fair chance is what I like to say. Now, some of us that might be less amount of time. Some of us might need more. It's healthy to give ourselves a little bit of space to retract a little bit, create an opportunity, some space to do the work that we need to do, so that we can really start trying in a different way when we resume.
The word that I probably have that I use the most in my work is habits. And people always want to know, okay, how long does it take to create a habit?
Yeah.
Because people, it's comforting to have a number, right? It's comforting to have a limit and a boundary, so I can know, what are my parameters of either success or failure. Sure. And unfortunately, just like with the amount of time it takes to create that friendly environment, the amount of time it takes to create habits out of the things that are going to create that friendly environment are also elusive. It's really about being persistent. It's about searching for those underlying causes. It's about acknowledging the things that are invisible that are probably affecting you and really diving into it instead of just hoping for the best.
But at least it's a goal at some point in the future, and we're not having to ask ourselves that question every week or every cycle, because that can become very draining as well.
You have a resource of your own, or a method of your own, the Positive Pregnancy Method. Tell us a little bit about that.
So I created a program called the Positive Pregnancy Method, which teaches couples how to understand their body, start to investigate deeper, running lab work, how to interpret those results, and how to then create a plan based on those results for themselves. And so it's a 6-module program that they work through to really, give them answers and help them create a plan. I'm often talking about finding answers and creating a plan for themselves that's unique for their individual situation. And this is really what allows them to do that.
It seems so trivial, but it's like, we don't usually have plans when we're trying to make changes. We're just trying to barrel through it. So it's nice to have somebody like you give me an organized way of getting to where I need to go. That's actually going to help me get there this time, right?
Absolutely. I think that's essential versus just being pulled anywhere Dr. Google tells you to go.
Oh, Dr. Google. He's an evil guy. I will put a link to that on the description of this video for everybody to go check out, and hopefully they'll see you again soon. Marc, thank you so much for being with us today. You're helping to shape so many happy futures, I believe, for the better. For those of you watching, don't forget, starting a family takes a community, which means asking for help from those of us in your community who are cheering you on. Until next time, I'm Joey Coppedge, the Fertility Nutrition Coach. Be well.